All right, picture this. An emergency room buzzing with activity, alarms beeping, and someone gasping for air. Now imagine you're the one standing by the patient and there's a machine right next to you, the mechanical ventilator. What exactly does it do? And how do respiratory therapists make it the life-saving tool it is? Let's break it down, quick, simple, and right to the point. Mechanical ventilation, in its simplest form, takes over or supports a patient's breathing when they can't do it themselves. Think of it as a super smart pump that pushes oxygen-rich air into the lungs and helps get rid of carbon dioxide. We use it for everything from severe asthma attacks to trauma, pneumonia, or post-surgery recovery. Here's where it gets really interesting. The ventilator isn't just a one-size-fits-all device. It's got settings for volume, pressure, and oxygen levels, and these need to be just right for each patient. Too much, and you risk injuring the lungs. Too little, and the patient's organs don't get enough oxygen. This is where the role of the respiratory therapist comes in, and honestly, they're absolute lifesavers. Respiratory therapists are the masters of the ventilator. They interpret blood gases, adjust settings, and work hand in hand with doctors and nurses to keep patients safe. They're constantly monitoring for changes, watching for things like lung compliance, airway resistance, and subtle signs of distress that could mean something's off. Let's say a patient suddenly starts fighting the ventilator. Maybe they're uncomfortable or the settings need tweaking. Respiratory therapists jump in, assess the situation, and make real-time adjustments. It's like being an air traffic controller for the lungs, keeping everything running smoothly and safely. And here's a cool fact. As technology improves, ventilators are getting smarter, offering modes that sync with a patient's natural breathing, or even adapt based on real-time feedback. But at the heart of it all, it's that human touch, the therapist's expertise, that makes the difference. So next time you see a ventilator in action, remember, it's not just a machine. It's a team effort, with respiratory therapists at the helm, making split-second decisions and saving lives, one breath at a time. If you're a med student aspiring to be part of this world, take the time to learn the basics, ask questions, and work closely with your respiratory therapy colleagues. They'll be your go-to people in the ICU. Thanks for tuning in, and keep breathing easy.